Governor Charlie Baker today announcing that Massachusetts is staying on track when it comes to the pace of their COVID-19 vaccine rollout. But right now, some people are struggling with the decision to get the vaccine, the portion of the healthcare field that's currently pregnant. At Bay State Medical Center, doctors have developed a guide to help make the best choice. Western Mass News reporter Audrey Russo, she joins us live in Springfield with more. Audrey.
According to doctors at Bay State Medical Center, if you're a COVID-19 patient who's pregnant, your chances of winding up in intensive care are 5 times higher. Now, on the other hand, the effects of the COVID-19 vaccine in pregnancies haven't really been studied. So these local doctors are trying to help women balance these two choices.
We tend not to give pregnant people things that haven't been extensively tested in pregnancy.
It's a decision pregnant healthcare workers have to make now to get the COVID-19 vaccine or not. And further down the line, others who are pregnant will face the same choice. Elizabeth Schoenfeld is the vice chair of research for Bay State Medical Center's emergency department. She says the effects of the COVID-19 vaccines on pregnancy have not been fully tested. However, the effects of the virus on pregnancy are serious. Schoenfeld has developed a decision aid to help people balance the risks.
If you are older or you have diabetes or you have high blood pressure, your risk of getting severe COVID is higher, and you may really want to think about getting the vaccine. If you don't work in healthcare and you're able to really isolate from other people and you can always wear masks and you're really staying very separate, your risk of COVID may be a lot lower.
Lauren Westifer, a professor of emergency medicine at UMass Medical School's Bay State campus, also helped develop the guide. For her, the work is personal.
My test just turned positive.
She's not talking about a COVID test. Westifer and her wife are expecting another child. She says even as a healthcare worker, there wasn't a lot of information about the vaccines and pregnancy.
Even though both trials were over 30,000 people, they did not include any pregnant or lactating people despite the large workforce. So I was sort of left with well, what do I do?
Westifer tells Western Mass News she ended up choosing to get the vaccine.
Helping create the decision made was really helpful for me personally.
As for the long-term effects on those hoping to become pregnant,
there really have never been vaccines that affected future fertility, so it would be very unlikely that any of the mechanisms involved in this vaccine should affect future fertility.
If you're pregnant and want more information, we have links to the decision aid on our website, westernmassnews.com, and it does come in multiple languages. Reporting live in Springfield, Audrey Russo for Western Mass News.